Good morning. It is May 1st. That puts me at 21 days since getting my all-on-4 procedure done. I had somebody question how I clean them and the experience with the use of the water pick, which is actually very interesting. The first week, when my gums were really inflamed and very swollen and very tender, I used a baby toothbrush, like a very light bristled baby toothbrush, just to like lightly brush the teeth themselves, the appliance themselves, and never going past the appliance into the gum line. That would have been really, really painful. But you do got to keep them clean. They can get dirty. They do have crevices and where food can get stuck on them, and they do build up plaque very easily. Actually, the resin teeth, the temporaries at least, uh, these really build plaque quickly. You can feel it. You can feel on any of the smooth areas. You can feel where it gets like kind of grainy and bumpy and stuff, and you can actually scratch that stuff off. It is plaque, just like what would occur naturally on your teeth. So you do have to really keep it clean. For the first week, very light brushing with a baby toothbrush just to get all the cracks and crevices. But uh, on top of that, you, for the first week, you can't really do any swishing. You can't be like, can't do any of that. That's bad. You need your gums to be able to heal. You don't want to put pressure from, blowing up your mouth or, swishing or anything like that. So they gave me a mouthwash, something silver. I don't know. It was kind of a weird brown stuff. It was like minty. It was some sort of like medicated mouthwash. And you just put a little bit in your mouth and you go, and then you spit it out and you just kind of let that coat your mouth rather than swishing or trying to get rid of any food particles. For the first 10 days or so, you're not even supposed to use a water pick because you can, blow up the stitches and you don't want to do any of that. So, but now, of course, being at 21 days, I am trying to use well, I'm using the water pick every day, multiple times a day. Every time I eat, I use the water pick. And the gums are still tender. I still have bone that's healing underneath both areas. That's going to be sore, I'm guessing, probably for a few months. But you can, get the water pick in there up along the gum line. Now, they told me to use a water pick that has like this hook. It's a hook like that, right? And what they wanted me to do was push it up in here over the top of the appliance and shoot it down across and then do the same for the bottom. Uh, Not possible. So you can see it goes really all the way up to the top. There's no room for that appliance yet. Uh, that could be because of swelling or just because of the shape of my face. I don't know. But the standard water pick, which kind of points at this angle, I can get it up there and I can tilt it and get it along the line, the gap line, to shoot water in there. That is relatively uncomfortable at this place. I guess sometimes painful. When I first started using it, it was painful. I used it on the lowest setting. It is a little jet of water that's pretty powerful. Uh, and it is nice to get stuff out. It actually helped to blow out some of the stitching because the stitches they use are the dissolvable stitches, and after about 10 to 15 days, they start to dissolve and break away, but they're stuck in there. So the water pick did help to get rid of some of those, the little knots and stuff that haven't dissolved yet. I did at least 3 or 4 of those that I can remember came out when I was using the water pick. So that's okay. Um, but it is interesting because the water pick, it pulses. It doesn't just shoot a stream. It like jets, boom, 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 boom. It's like a little water jackhammer that pushes on your gums. And so that is still kind of painful. It's pretty powerful. Uh, there's not a whole lot of a gap yet. I don't know if you could see. Right, there's my gap. There isn't a gap. It's just where it, see where it reaches. You can't really get anything in between there. It's starting, I guess, and these will have more of a gap as healing continues and the swelling goes down. But right now, I, I'm kind of, it doesn't really feel like much is going through. Just very little can go through, but not much. But I'm doing it anyway just to make sure. And it does get some stuff out that uh, you didn't know was in there. Um, do that on the top and bottom, right? And what I do use that hooked one for is actually for the inside. I do it from the back side. I can hook around on the inside of the arches and shoot in there. So I do the normal pick for the front uh, on both the top and bottom, and then I use the hooked pick from the inside to shoot water back through the other direction as well. And I do that every morning after breakfast. I don't normally eat lunch, so I haven't been doing that during lunchtime. I do it every time I eat, and I do it after dinner, of course, to get rid of anything. And if I happen to get hungry later and I have like a snack or something, I'll use the water pick again to make sure there's no gunk in there. On top of that, they told me to go ahead and use an electric toothbrush, like a spin brush. So that's what I have. I have a spin brush that has a little spinning, rotating head on the top. That's about the size of the tip of your finger, right? Tip of your pinky. And that spins back and forth. And then there's another section of the brush that vibrates and goes up and down. So you've got these two pieces, one going this way, back and forth, and one going up and down. So I do use that. Initially, I was concerned about that because the vibration is actually pretty strong. And I was worried about what that might do to the implants and stuff. But they told me that's not a problem. So now I'm using that. And I brush the teeth all the way up and down. Now I am going all the way up to the gum line on both the top and bottom on the inside as well. So I do a full brushing of my teeth just like normal, just like you would brush your teeth. You don't need fluoride and you don't need whitening toothpaste. So just like a mild, non-abrasive toothpaste they said was really good. It's more just to keep everything clean. So full brushing of the teeth, I don't know, sing the ABCs or Twinkle Twinkle Little Star, whatever you need to do while you're doing it. But just make sure everything is thoroughly cleaned, front, sides, back, surface, edge, surface, inside, all the way around the appliance. And then I'm rinsing with a non-alcohol or like an alcohol-free gum support mouthwash. It's like Scope or Listerine or something like that. Doesn't have alcohol, so it's not very harsh. And that's really nice as my final. So I use a water pick first to get any junk or things out. Then I brush real good, and then I rinse with the mouthwash. Total time, I would say probably takes a good 5 minutes of my time is dedicated to cleaning my teeth, which is longer than normal than just brush your teeth and go. You do need to take a little bit of time, make sure you're thorough about it, and keep your teeth clean. I suspect people who have really great oral care, people who have great natural teeth, and have great cleaning habits with their teeth, probably already do that. Neat thing is I don't need to use any type of floss. There's no way to do that. There's not a big enough gap to floss underneath or in between. Some of the methods that people do, like I think where they do actually put in your permanent teeth on the first day, well, eventually this gap is going to grow. That's going to be a bigger gap. And if that's your permanent set that's never going to change, you're going to have a gap that you will have to floss through. These being temporaries, when that gap appears, when I get these changed out, the permanent set is going to be formed to the way my actual gums are. So there won't be a gap and I won't be able to floss. The gap, I'm guessing, will be similar to this, where you can't see it unless I show it to you. It literally, I can't open my mouth enough for you to see the gap. And you can see they look natural. Top and bottom, there's no, you can't see, there's no screws. I mean, there are screws. but those are covered with a UV hardening resin, just like they use for tooth fillings. Um, and yeah, so that's the cleaning process, and I do that, like I said, every time I eat. At first, it will be uncomfortable. The water pick is kind of funny. It is messy, or it can be anyway. I'm sure I'll get more efficient at it as I go. But I do currently. I just lean over the sink. I mean, I'm elbows on the sink and leaning over it, looking at myself in the mirror, using the water pick, making sure that I'm not dribbling water all over myself or all over the counter and the floor and stuff. So I'm right over the sink when I'm doing it because it is a constant spray of water. Your mouth fills up pretty quick, and initially, it's like anything, it's a process. So you have to do things in a certain order. If your mouth gets full of water and you pull the water pick out before you turn the water stream off, you're shooting water all over the place or in your own eye and up your nose, and it's it's frustrating but kind of funny at the same time. Obviously, you get used to it. At this point, I'm like spray, 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 spray. When my mouth starts to get full of water, I turn it off, pull it out of my mouth, spit the water out, put it back in, continue doing what I need to do. But it's not bad, and I'm really excited about when I'm able to use the water pick at a higher setting and really blast that out and keep it really clean, because I like the feeling of it being really clean and nice. That's actually the best feeling. When you wake up in the morning, especially if you like sleep with your mouth open or anything like that, they can dry out really easy. These aren't gums, right? So that's like hard resin. So there's no natural moisture to that. So they do feel kind of sticky and dry in the morning when you wake up. Uh, so it's nice in the morning to, rinse your mouth out. That's the first thing, even if you hadn't had any food or coffee or anything like that. Just I keep a water bottle next to on my nightstand. When I wake up in the morning, first thing I do is I grab the water bottle, take a swig, wish around. Yeah, that feels great in the morning. Uh, as the day goes on, I've noticed that a couple hours into the day, I'm not really so much dealing with the teeth. Later in the afternoon, though, when I've been talking and stuff, I do. It feels different against your lips and stuff, and I start to. I don't know. The best word I could describe for it is kind of like fatigue, but it's not. I mean, you're not really tired, but you feel it a little bit more in the afternoon, uh, and that's something that will go away, I'm sure, over time. But at this point, 21 days, I'm not totally used to it. They still feel new. They still feel not real. Uh, they don't feel like they're part of me exactly. They more feel like they're like encapsulating my natural teeth. It doesn't feel like I don't have teeth. It feels like I have got a like a cap over the whole area where my teeth used to be. I do experience phantom pains. That's weird. Um, I guess there's probably still nerve stuff that wants to connect to what used to be there, and maybe that's what I don't know what phantom pains are exactly, but I know that sometimes my teeth hurt, and I know I don't have teeth, so that can't be. Uh, it's an interesting process, and I can't wait to get my permanent set. I think they're going to fit a little better, and I'll certainly talk to the prosthodontist at that time when we design those teeth, and talk to them about any of the issues that I may still be having at that time that we may be able to correct with little changes in uh, some of the sizing with the inner piece and things like that. But that's it. That's my update for today. I hope that it's giving you some insight to the process. It's not really complex, but it is a process, and you do have to be pretty dedicated to it. You got to be thorough. You want to keep them clean. You want to keep them healthy. If you have any questions or comments, leave them down below. If I see them, I'll answer. Otherwise, have a great day.